From the Central Western Washington area, Choice Regional Health Network presents the Equity Circle podcast, a place for information with integrity, accountability, and innovation. Enjoy the episode. All right, everyone. Welcome to the Equity Circle podcast. Excited to be here with some new guests to the show, but someone we've been working with for quite a number of months now. So welcome Corey Dow and Emily Siders.
Thank you, Lawrence. We're so happy to be here, and we're excited for this opportunity to do this podcast with you. Thank you.
Thanks for having us.
Absolutely. So we're just before we get started into what we're going to be talking about today, why don't you just kind of tell us a little bit more about yourself, Corey? I'll start with you. Tell us something about yourself. Help us get to know you a little bit more.
I'm Corey Dow. I'm the Executive Director of Youth and Family Link. We're based in Longview, Washington, and serve Cowlitz County. I've been with Youth and Family Link since 2018. I grew up in Cowlitz County, and I just really was excited to be able to be a part of an agency that does a whole lot of different things around the community. It's a really fun place to be a part of.
Thanks, Corey. And Emily?
Hi, I'm Emily Siders, and I'm the Community Program Coordinator at Youth and Family Link. I've been at Link for almost 8 years, and I coordinate all the community events, activities, fundraisers, community partnerships. I work with funders. I run different programs like the ABCD dental program and our oral health connections program. And I also run a Beyond the Alphabet program here at Youth and Family Link. So, Youth and Family Link is a great community resource here in Cowlitz County, and we're so happy to be able to do so much for the community.
Awesome. Well, thank you so much for just getting our listeners a chance to get to know you a little bit. My first question is, I'll start with Emily this time. Talk to us about, what this last year has been being involved in COVID vaccine work and kind of some of the challenges that you have faced.
We've had a really busy last year. We've been involved with so many different partners and have been out in the community so much, which has been great because we've been able to get out and about and do stuff in the community. So we're thankful that we are able to do this type of work. We're trying to host monthly vaccine clinics in Cowlitz and Cayuga County. So far, we've hosted clinics in Longview, Kelso, Willamette, and then we are going into Woodland tomorrow for a clinic, and then we're looking at doing Kalama in the coming months. So it's been great. We've been able to meet so many new people, so many new partners. Some of our partners that we have worked with for lots of our clinics is the Ethnic Support Council and Amera Group and Molina Healthcare and other healthcare providers, insurance providers have helped us out, sponsored our events. We've been able to make connections with lots of community members and be able to get their take on what's going on in the world surrounding the pandemic. There has been some challenges around vaccine hesitancy, and that's everywhere right now, and we're trying to do our best to overcome and address the hesitancy issues in our communities. I'd say that's our biggest challenge right now. We've been offering vaccines for children ages 5 to 11 and adults. We've done first and second dose clinics. We've done booster clinics. We try to offer as much as possible. What our clinic structure looks like is we try to make them more resource fair-like. So when families come, they're not just coming for a vaccine, they're coming to get other resources. So they're not leaving empty-handed. They're getting resources from Head Start, the Family Health Center, the Ethnic Support Council, various different community resource agencies are there at the event to talk to them about what they have to offer to the community. So it's been really great. We've been able to, have all these people pull together to help people in this hard time of all of our lives.
Yeah. So it sounds like, I mean, obviously you've been very, very immersed in this COVID world, and it sounds like as of late in some of the vaccine clinics that you've done, it's kind of, it sounds like it's not just a clinic. Am I hearing you right on that?
Yeah, it's definitely a lot more than just a clinic. And some people even come not even to get their vaccine. They might have already been vaccinated and they're just coming to get the other resources. So
Yeah.
it's been really great. And we've been able to offer, um, gifts to people getting vaccinated, such as, as a thank you for them, we've given out some local restaurant gift cards, some other fun items for them to take away after they get their vaccine or get resources. And yeah, it's just, at some of the events, we'll have a little bit of kids activities going on. We want the kids to feel comfortable and to be able to, not feel like they're coming to like a hospital setting to get their vaccine. They're
Right.
coming into a gymnasium when they come into our facility, and they get to, see all these, fun stuff going on. So it's been great.
Hmm. Well, that sounds really amazing. And I think, that's one of the things I wanted to highlight was the fact that it felt more like a clinic, right? More just like something that you go in and get your shot and get out. And so for people to come out and leave with more than what they came with, I think is really awesome. Corey, my next question for you is, what have been some of the positive changes or things that have come out of it? I think it is so easy sometimes for us to focus on all the difficulties, right? And we've all certainly experienced those, and I know that you guys have as well. But what are some of the positive things that have come out of this that you want to continue to grow on in 2022?
I think one of the things that has really been a positive of this, and some of that comes out of what Emily was just saying, is the partnerships that we have developed. We've always tried to do a model that included bringing in community partners and introducing the families that we work with to other entities that are doing work in the community. And the vaccine work has opened up a whole different connections with some agencies. Last summer there wasn't a lot of things going on, and so when the Ethnic Support Council also stepped into this arena of work, that really solidified a partnership for us of ways that we could work together and connect together. We've had a lot of other partners that we maybe before didn't work with all that closely, and we've had a lot of opportunity to get creative with them as we've looked at ways to help share information. And also, we've needed to lean on some of those partners in ways we wouldn't have before, because when you're making vaccines available in your building, people ask you questions about vaccines.
Yeah.
And we're not experts, but that has allowed us to get to know the people who are experts better.
Yeah.
Because we now have a connection to go to them and kind of help ask those questions on behalf of the community. I think that's a huge benefit that I wouldn't have seen coming. And I'm really excited about being able to work with those partners in the future and address other community health issues. Part of families being healthy and successful is that physical health messaging.
Yeah, absolutely. So it sounds like the partnerships have obviously been a huge help, but it's also just getting an idea of where to go when you need help and some of the questions that either you or the community have. Is that fair?
Yes, absolutely. Yeah. We get a lot of questions about COVID. And the thing about it is when people start asking you about vaccines, they'll also start talking to you about their other medical experiences.
Yeah.
And if it's not something that we do, if it's not our area of expertise, we will do our best to help them find the answers, connect them with maybe one of those other partners that we've gotten to know that is what they do.
Yeah.
Been really great to get to see those things.
Yeah. Oh, there's something you mentioned I wanted to kind of press in on a little bit. I know we were talking about like some of the good things that have come out of this pandemic, but I think one of the challenges that you highlighted, and I know our organization as well as others have faced when you've kind of had to become an expert in things that you never you never really knew a lot about. For me, it's not having a medical background at all, just having more of a social services, human services background, and then getting into vaccines and learning quite a bit, of course, from this podcast. I'm wondering if I'll start with Emily. I'm wondering if you can kind of touch on that and what that experience has been like for you.
Yeah, definitely. And we Youth and Family Link has never really been a healthcare or medical provider. We've always done social services. We run after school programs. We have our outreach and engagement program where we connect families to resources that they're in need of. We have, just different programs that aren't really medical based. We do being healthy is part of our mission. So we do connect a lot of families to medical resources, but it's not something we've ever provided. So jumping into all this vaccine work has definitely been different. And it's been, it's been a hurdle to overcome because
Sure.
like we don't have medical background. We didn't go to school. We're not doctors. We're not nurses. So it's a learning curve, and we've been thankful for all the resources that have been handed down to us from you guys and other providers, Kaiser. We've been through lots of different trainings and trying to learn it so that we can pass down the accurate information to the clients that we're serving. Because if we're providing these vaccines, we want to make sure that we're able to speak about them and speak about them accurately.
Yeah, absolutely. Corey, is there anything you wanted to add on to that?
No, I think Emily brought it up. It's been a huge learning curve for all of us. We joke around here. Like I occasionally say sentences to Emily, and I think a year and a half ago, I did not know those words.
Right.
So we have learned a lot, but I also think there's been a great opportunity, like when people ask us questions at times, to be able to say, you know what, I'm not sure. Let's find out together.
Sure. Yeah.
And that's been a little bit of a relationship builder also.
Yeah. Yeah. Well, I think, being able to say, you know what, I don't know is, I think one, it definitely takes some humility. But I also think it you just kind of mentioned it like that. It builds that relationship, I think, with people, and knowing that we don't have to be experts, and knowing that we can lean on other people in our community to help us, I think is so huge, especially navigating through this, right? Because, we've all touched on, not having that medical background and some of the experience and things is that we've had to learn. So my next question is for you, Corey. I'm curious if you can just talk about what has been some of the benefits you've seen of doing these clinics in your community. I know you've talked about partnerships and some of the things, but even just maybe more specifically for like community members, what have you seen with that?
One of the things that has been really interesting to me is because we are an organization that really is always focused on youth and families. So it's a pretty specific population. We get to know kids. We might get to know their parents. Sometimes maybe their grandparents, if there's a grandparent raising a grandchild. This work has really broadened who we're talking to. And, at our clinics, there are 5-year-olds there, and, we vaccinated people over 90. And the opportunity to really increase who we talk to has been huge, and sort of hear what they think about the community. One of the things that we always talk about, wanting to know what the community needs. And this has opened up some conversations with people that had never before had a reason to come inside the Link gym, and really getting to know a little bit more of our community that we hadn't had the opportunity to get to know before.
Yeah,
that's awesome.
It's definitely helped us connect people that, like Corey said, have never been exposed to Youth and Family Link. Well, some of the kids that we vaccinated, we were able to connect to our ABCD program and to our Team Tuesday activity that we do. So it's like kids and families that have never heard of us before, but came here to get their vaccine, and now they're in our other program. So it's really a win-win for all of us.
That's awesome. Well, this is my my next question is for you, Emily. It's more so about I know you both have talked about the uniqueness of some of the community members that you've been able to serve, and as well as some of the different things that Youth and Family Link does. But I'm wondering if there's maybe something unique about Youth and Family Link that people don't know, or maybe don't often know, that you'd like to share about Youth and Family Link.
Yeah, I think that no one really knows what all Youth and Family Link does, because we do so much, and that's what is the most unique thing about us is we talk to the community and we try to find what the community thinks is needed, and that's where we will develop programs. So it's not it we take it from the community on what we think is needed. So for example, a couple years ago, there was a group of moms that said, there's nothing for moms to do with their young babies and their young toddlers. So they brought it up in we had a focus group. They brought it up and was talking about that there's nothing to do. So that's where we went out and we found, the funding to develop a program based off the needs that were, being expressed. And we developed the Beyond the Alphabet program, and it's a program for 0 to 7-year-olds, and it's for moms to, pre-pandemic, it was in person in our gymnasiums, and moms would come together and they'd get time to socialize and share experiences with each other, and then they would also, their kids could also socialize. Having that social interaction at a young age is really important. And then we integrate parenting classes into the program, and nutrition education classes, and all kinds of different things, just to get the family on, making sure that they're being involved in positive activities, and just get them where they're being social. And that's one thing that is very unique about Youth and Family Link is we're willing to take on anything that the community tells us is needed. And that goes along with our over in Kelso, we're actually building a facility over there to serve the South Kelso neighborhood. And that's another example of a project where the community said it's too hard to get over to Longview to our building because a lot of them don't have transportation. So we went to them. We built a facility in their neighborhood, and we're going to be running preschool classes out of that facility. And other
That's awesome.
There's going to be a multi-use center over there where kids and families can come in. There's going to be a kitchen. They can cook. They can, get resources. They can have parent support groups. They can, just hang out. So, that's one thing. That's the most unique thing about Youth and Family Link is we will go after anything that the community.
I like that. I like that ability to come in and not necessarily tell a community what you're going to do, but listen to what they want and then do that. I like that approach quite a bit. Corey, is there anything else you wanted to add to that?
Now, that really sums up what I loved when I first started working at Link, and what I still love about Link is, like you, Lawrence, I've always worked in social services, and I've sat around a lot of tables and meetings where we've all talked about the community needs this and somebody should. And coming to Link, I get to be a part of the other side, where when somebody says the community needs this, I feel like I'm now a part of the opportunity to say, oh, well, let's figure out how to make that happen.
Yeah. Everyone always comes to us if they think that the community needs something. They come to us, and we are usually able to provide it. And we rarely ever turn down any opportunities to serve our community.
Well, that's wonderful. Thank you so much for sharing that, and for really just taking the time to be on the podcast today. As we come to a close, I'm wondering, I'll start with you, Corey, if there's anything final you would just like to share.
Just really we enjoy getting out in the community and connecting with the community. It's been amazing getting to interact with people. Whoever knew I would think something like a vaccine clinic would be fun, but honestly, it is really fun. Tomorrow, I don't know if we mentioned it yet,
But yeah, that's
Lauren,
right. Yeah, please. I'm glad we're bringing it up now. Yes, please bring it up.
tomorrow I will, which by the time this is out, it won't be tomorrow anymore, but I will be along with a lot of other Link staff at an event at Woodland High School. It's a big multi-partner vaccine clinic, and who would have thought I'd look forward to hanging out at a vaccine clinic on a Saturday? But all honesty, it's really fun to be out in the community again and talking
Yeah.
to people and helping our community.
Yeah.
It's been great.
Well, yeah, and before we get to Emily, I'm glad you brought that up, Corey. You know, as we're recording this, it's February 11th, and you know, tomorrow is obviously the 12th, and excited to have this vaccination clinic, which I know Youth and Family Link and Choice and others are involved with, and we're excited to be able to provide it. So thank you for sharing that and bringing that up. And so Emily, I'll let you get a chance to share any final things you'd like to share.
Yeah, I just want to say we're so thankful for the partnership with Choice and Kaiser and Medical Teams International. Medical Teams International has volunteered at all of our vaccine events, and you know, they've been great in providing vaccines to the community, and we're so thankful for them, and you know, appreciate all the support and all the connections that you, Lauren, have helped us make with all the different resource providers. And you know, those are going to be lasting connections even after all this vaccine work is done. We're going to be able to continue to partner with all of the people that you helped connect us to. So thank you for that.
Thank you. I really do appreciate it. And thank you both so much for being on the podcast today. I also want to thank our listeners for listening to another episode of the Equity Circle podcast. Please share with friends and family. Make sure to subscribe and leave us a review. It helps others find the podcast. And lastly, remember that equity equals progress.